The Center of Awareness Global Peace Mission is seeking the collaboration of scientists and scientific institutions to aid the test and ascertain the authenticity of some medical products they have, which they believe can help cure the COVID-19. Speaking at a media engagement today, Executive President Professor Samuel Duncan revealed some of the injectables and immune boosters were sent to Wuhan, China 2 weeks ago, and 2 sufferers of COVID-19 who were at the verge of death are now responding to treatment. Well, Professor Duncan is actually here in the studio, and he's joining us for that conversation. Professor Duncan, you're welcome.
Thank you.
Okay, first of all, I can see something on the table. What is this?
Yeah, they're the core injectables.
These are the injectables?
Yes.
These are what you sent to China?
Yes.
Okay, why did you send them to China?
Some Chinese in Ghana approached me and asked for medicine to be sent to China to treat coronavirus.
But I know that isn't this the Kowa FS? Is a food supplement?
Yeah, we have the Kowa FS and we have the Kowa injectables.
So these are the injectables?
The injectables are mainly for viral infections.
Okay. And then the other one is a food supplement.
Food supplement that boosts the immune system.
Okay, I just needed to clear that up.
Okay.
So you sent this to China for it to be tested.
Yes.
What has happened?
Within 5 days, well, 2 people who were about to, according to them, they were at the verge of dying, and they applied the Kowa 72 and FS on them, and within 5 days, they were revived and now out of the hospital. So we felt that this was a good news. Prior to that, this has gone through a lot of scientific analysis. For about 15 years, we spent a lot of money to research into finding lasting solution to viral infection, especially HIV, hepatitis B, and herpes simplex viruses. And we've made a remarkable achievement. So prior to them coming for the product, we also thought that there was the need for us to do further research on this against coronavirus. So when the news came, it was a very good news to us. But
how do we know that they were not already on the road to recovery? How do we know that specifically this is what aided their recovery? Because I haven't seen anything to that effect.
Okay, actually, when the medicines were sent to the place, they were afraid to apply on the patients. But they felt that, oh, these 2 people are about to die, so let us try. If it doesn't work, there's no problem. But when they tried, it worked on them and they recovered. But to us, it is not scientific. Now they are,
right.
Yes, there are a lot of people are now on the core products. But to us, it is not scientific, hence not conclusive. And that is why the press conference, just to alert international scientists to come together to see whether this can actually work scientifically. What I mean scientifically is there should be a control trials, that there should be a standard protocol set by one of the organizations.
Normally, if they're doing such a test and trials, how is it done? And how long does it normally run for?
This one is acute approach. Well, the way
acute approach meaning?
Short-term measures.
Okay.
Right? Because the rate the coronavirus is spreading, if you don't take care, it can wipe all of us. So there's a need for an immediate kind of research. So you can put about 100, 200 people on the product and monitor them within 1 week to 3 weeks. If it works, then it means it has some activity that will begin to adopt that for an immediate antidote to the coronavirus. And we can also develop, if it works, we can also develop vaccines from the same formula. So this is the time we must start something as early as possible.
So when you're asking scientific institutions and other people to come on board, what are you asking them for? What are you saying to them?
Yes, what I'm trying to say is there's something in Ghana that has potentials against wide spectrum of viruses, and COVID-19 is not an exception. So let us try. I believe in science, and we are doing science. And in science, you don't just conclude. So, and
there needs to be testing,
yeah, there
and
should be.
research.
You should have a logical conclusion to whatever you are talking about. And that is why it has taken about 15 years to research into this. So now this is a immediate approach. Now it is working in China, but it
Supposedly.
is, yeah, supposedly. And this is not conclusive.
Exactly.
Yes, and it is not scientific. Scientifically, let's put about 200 people on this product.
So that
has
means
qualified
200
for
people that you're going to test this on. Is this going to be voluntary, or, I mean, how do you test something of this nature on people? Where and how?
Yeah. People
You need
who
people who already have coronavirus?
That is, those people who have been affected with the viruses and almost dying. Those are the people we have to try this on. And if it works, then it means it is an antidote. And we can do further research into it and improve upon this for it to be a permanent solution for this coronavirus
so
epidemic.
You said this is going to be like an acute approach, which will be you said a short-term, possibly 3 weeks,
yes,
4
to
weeks,
1 month.
To 1 month.
Yes.
How much does it cost to do such testing and research?
Actually, it depends. This will not cost so much because this is not the sample size will not be big, but it cannot be done in Ghana here. It can be done in where there's this infections. So it can be done in China, Italy, or wherever. Now this research should be led by a research institution like Noguchi in Ghana here, and they can link with
other
research institutions in
so
those
is it
areas.
possible that a research institution in China would approach you to do this, or have they approached you to do this? A research institution in China, since you said it was tested in China, has any research institution already approached you to do this?
No, this was done privately.
Okay.
Yes, and that is why we are coming out to say we don't want to just conclude. I think China is suffering already, and this is the time if there's something that can be tested, and if it works, then to save millions of people in China and other parts of the world. So this is the core. We could have taken a longer period to go through the processes of trying to try this, and that could take us about 6 to 1 year. Now by then a lot of people would have been wiped off by this particular virus.
So where specifically in China, or which institution in China tested this?
That it was sent to Wuhan province.
Not tested, but they tested it on patients.
Patients,
right?
yes. Yeah. It was tested in a hospital in Wuhan.
Wuhan, okay.
Yes. And our agent here, who is also a Chinese, she organized and sent this through an airline, and it was picked by some soldiers. It was sent to the hospital, and 2 doctors were on standby. They actually communicated.
How did they hear about it?
Oh, they had then taken some of the core FS prior to the.
That's the food supplement.
The food supplement, the food supplement, and it was working for them. And it will interest you to know that Chinese came down to Ghana here to look for the formula and the patent. They just want to buy the formula and produce before even the corona outbreak. You see, and so this is what we have in Ghana here, and people were ready to buy it because it was working for them on a whole lot of issues. Now, when this came up, then they realized, no, this is antiviral. This is an immune booster that supports the immune system. So why don't you try? And they've also heard of the injectables, which have gone to clinical trials. It has qualified for clinical trials. And it will interest you.
These are the injectables that have qualified for clinical trials.
Yes.
Okay.
Yes. So
In Ghana or?
In Ghana.
Okay.
And this is the first of its kind that injection has been developed out of plants.
It's plant-based?
Plant-based, organic based. And this is also the first time a herbal medicine has qualified for clinical trials in Ghana here, which means a lot of research has gone into this. And we believe in science, so we don't want to jump to conclusions. So let us do a proper scientific trial using the standard protocol. So at the end of the day, World Health Organization can say, oh, when it was tested, it worked. Now let us adopt this as the antidote to this coronavirus.
That's
epidemic.
interesting. I mean, you know, I'm happy that you're insisting that it has to be tested and there has to be trials because, like you said, you believe in science and it has to be scientific.
Yes.
Okay, so that's very interesting. So the scientific institutions should come and support you, come together and push this through.
That's it.
Okay, thank you very much. We've been speaking to Professor Samuel Duncan, and he has these injectables, and also he has the other formula, which is the Corfest food supplement, which has already been certified
By the Food Address Authority as an immune
booster. Okay, so COVID-19, maybe you should watch out because there's an antidote supposedly, but it's yet to be tried.